I'm Jason Anschutz with Sanford Health News. Representatives from Sanford Health are taking part in the American Hospital Association's annual Rural Healthcare Leadership Conference in Orlando. And today we are joined by Sanford Health's Chief Nursing Officer, Erica DeBoer. Erica, thank you for joining us. You will be sharing how Sanford Health is building a more sustainable rural nursing workforce. Why is this topic more important than ever right now?
Our workforce is, of course, the very heart of how we do our work. It's how we can care for our rural communities. And so when I think about the opportunities that we have to leverage AI as well as other technology to reduce the burden on our frontline teams, it's more important now than ever as we look at really transforming the way that we care for our patients, no matter where they live.
Yeah, one of the questions we wanted to talk about was how Sanford Health is utilizing technology and AI to help support our nursing workforce. What is that non-value added work and how are we doing that?
So the way I define non-value add work is those things that don't necessarily contribute to the joy of the work and being able to make that connection with patients. So when I think about documentation burden, when I think about some of those traditional things that we do and spend a lot of time maybe in front of a computer screen instead of interacting with our colleagues and patients, those are the non-value add things. A couple of things that the Sanford has actually invested in over the last several years, as well as continuing to explore, is first, how do we use predictive analytics to plan and address some of our staffing concerns and needs? We know that our communities need us more now than ever. And so how do we make sure we have the right people in the right places at the right time? So in partnership with our EDA team or Enterprise Data and Analytics team, they're helping us to actually identify those census peaks and valleys and making sure we have the right teams there. We call it LAMP, and it was something that we developed ourselves to try to make sure to meet some of those needs. Data is a really important part of what we do, but more importantly, what is those technical things that we can put in place to bring value into the team? So Artisite, or our remote nursing, is a pilot program that we've started. We've been live for almost 6 months now. And so continuing to try to leverage technology to help us partner with our frontline teams and deliver care to our patients. I'd say the other third part that's really important in really engaging with our patients is the use of Notable to really enhance that digital experience. But most importantly, when I think about our workforce, how do we then make it easy for our frontline teams to see that information so that we can host that conversation in a different way with our patients, knowing that we have very little time with them? How do we make the most of that time?
Your presentation will talk about how, in addition to leveraging technology, empowering people and building trust are key to creating high functioning nursing teams. How do you apply these concepts at Sanford Health?
Amazing. Empowerment is a huge part of how we continue to engage our brilliant people at the bedside. So nurses obviously are scientists and they're innovative beings no matter what they need to do during their day. We empower our nursing staff through Enterprise Nursing Senate as well as other unit-based councils. Their voice is so incredibly important. And guess what? They're the ones that are doing the work. They're the ones that can help us identify the solutions that are going to help solve. And in some cases, it's not about technology, but how do we get rid of the stupid stuff that's not actually contributing value to our time and the care that we're trying to provide to our patients. So excited that we get to lift up our nursing teams, but more importantly, I think we all know that nurses can't do it by themselves. It takes an entire team working together to do the best possible things for our patients as well as for our colleagues.
And lastly, Erica, you're not just presenting this week, you're attending the conference as well. What are some top takeaways early on, and what are you hoping to bring back by the end of the week?
The energy is exciting here at the Rural Healthcare Summit. There's a lot of really great variety of individuals that anywhere from our critical access hospitals all the way to integrated systems as large as ours. What I'm most excited about is to continue to learn from them, as well as some of those strategies that they're putting in place. I'd say the other piece that I've found most valuable so far is networking with other amazing individuals in this field, as well as outside this field, because we can learn a lot from others outside the healthcare industry as well. So really incredible opportunity for me to be here, network, and reconnect with folks that I haven't had the opportunity to see for a while. So looking forward to more time.
Erica, thank you so much for joining us today from Orlando. That was Erica DeBoer, Sanford Health's Chief Nursing Officer. For Sanford Health News, I'm Jason Anschutz.